Frederick, we are with you now. Now you are very appropriate, but a difficult patient. Go ahead.
We have a difficult patient, and what I wanted to show you before is that when we use higher viscosity gels, I think that we need to be careful because we do a lot of false aspiration. So this is just to show you, even if I do a long aspiration like this, there is nothing coming back. So let's try a really low viscosity gel as this is Vital. If I do a short, nothing comes. So we really have to stay for a long time when we do aspiration. So remember, aspiration is not 100% sure, and unfortunately we've seen some intravascular compromises in the perioral region. I love to work with a microcannula. This is one of the reasons, but not only the only reason. The microcannula actually, for me, becomes in a way my three-dimensional GPS. By using the microcannula, I can differ from the different layer that was just shown to us. Because I want to avoid intramuscular injection, because that also creates a high risk of nodulus and not as nice results. I don't want to inject too superficial to have visible filler, but I just want to be on top of the orbicularis oris muscle, which is a layer I can find with my microcannula. Okay, so we're going to do this lateral from the columna filtrum with a microcannula. If I go for the filtrum or for the Cupid's bow, of course, I don't mess around with cannulas. We do this with a sharp needle, so we will do that as well. So what we have for considerations here, we looked at it previously a little bit. We need to create eversion in the upper lip. We have a high risk of creating too much projection and end up with hashtag duck lips otherwise. We also have always a small vein running quite close to the corner of the mouth, so we want to avoid that when we do our entry point. So it's just through the skin, we don't need to go any deep. I had a question before about anesthesia. This patient has no anesthesia prior to the treatment. In my opinion, mostly creams are quite good psychologically for the patient, but since we have fillers with lidocaine inside, we can use that to numb the lip. I've chosen
what are you injecting?
Yeah.
What are you injecting?
So what is the things that we need to consider when we choose gel for the lips? For me, I don't know any patients looking for hard lips. Everybody wants soft lips, right? But on the other hand, the lips are constantly moving, so we also want the gel to stay there, and that we can choose a gel with a higher cohesivity. So what we want is soft gels with high cohesivity. And this is Emervel Lips, and it has a low calibration, meaning it's quite small particle, but it's higher in cross-linking and more cohesive as a gel, so it will not move around in the same way. So this is one of my favorites for lips, and of course there are many good products out on the market. So let's see. First of all, since she has no numbness, I just enter very gently that plane on top of orbicularis oris muscle. And I'm actually right now basically in the transition between the wet and the dry mucosa. A small injection here will just numb the lip.
So the target is to volumize the upper lip. It's not the shape, it's the volumization, right?
We're going to try to change the shape with volume as well. So first line, it's about 0.1. We have basically 3 layers of injection, and I like to think it of creating a horseshoe implant.
Stay like that, stay like that. Now we are going to ask Fabian, could you show exactly where we are on the cadaver?
It's Sebastian.
Sebastian,
Okay.
could you show exactly where we are?
Yes. We are here in this area here, exactly at the boundary between the vermilion and the normal skin. where we have para-keratinized and keratinized epithelium, and we're exactly here. I'm following the movements.
So basically, we have three layers to attend to, and let's see if I just put that on the side for a second. If we look at my fist as a lip, and running inside we have the orbicularis oris, I like to think of it as a horseshoe implant, where we get eversion by injecting behind or in the wet mucosa with support of the teeth. The biggest mistake is to put too much in the vermilion border, because that creates projection, and we will end up in a duck lip or an unnatural result. Okay, so the first line, just to numb it. The second is close to the vermilion border, but not getting underneath the dermis, because that creates the white roll. And this is no volumizing. This is creating definition. This is where we treat for taking away lines. And then as the third layer, and with the cannula, as I described previously, I can feel the different tissues, layers of the tissues. So I feel resistance, and when I go through the orbicularis oris, and that makes it my three-dimensional GPS. So now we're actually on the other side, and adding volume here, we can see will help to evert the lip more. I normally do retrograde injection. I think working with cannulas, of course, gives better control. I know some like push ahead because it's numb as we come, but move it gently and it's not too painful. So that's just the lateral part of the upper lip to evert it. But of course, always treat upper and lower lip. And we just was shown the modulus and the insertion of the DAO. So we have, with our cannula, a small resistance here. Try to go superficial to avoid interfering with the blood vessels, and just all the way down. I respect the midline of the lower lip. I think that volumizing just lateral to the midline gives a nicer result. Gently, just move. In the lower lip, there is basically no point in getting into the wet mucosa, because gravity will help us to create that eversion and volume change as we're looking for. But I will definitely put a little bit of volume just in the vermilion border, like that. Okay, so with the cannula, it gives us and helps us to have smoother results. We still have not done any massaging with shaping or sculptrating. And thanks to finding that correct layer, it's much more easier for us.
So Frederick, actually you do not use ever sharp needles on the lips?
Well, let's see if we can show you this. What's coming into camera right now?
Okay, good. You see? It's my prediction.
Yeah. So, of course, it's a combination. I don't use sharp needles or cannulas for everything, but I feel safer. In the philtrum and the Cupid's bow, of course, it's impossible to create small changes in shape with a cannula. So from here, I go with sharp needle. But I'm also very well aware of the risk of intravascular interference. So it's a small volume injection, constantly looking both for blanching and bluish reticulation, which would mean a intravascular venous injection.
Sebastian, just remind us what we have to be careful in this area while injecting a sharp needle, the philtrum. Sebastian?
So I didn't really get that.
The dangerous here in the philtrum is that the arteries, the superior labial artery, runs to the midline and runs here in a lot of cases, it runs very superficial in the subcutaneous planes, and then gives off, in general, two branches that run parallel towards the base of the nose here in this area. Therefore, we have to be very careful not to perforate or injure these arteries that run here in this area.
So very, very superficial. Is it safe? Frederic.
Yeah, it's a very good point. We need to be careful and just as pointed out, don't inject large volume. If we do injections in areas like this, of course we need to be aware, we need to put a lot of intention to this. It's a small volume, it's quite superficial in just underneath the dermis, so I think we're fine, but you need to have a calculation of risk in that, of course.
Unfortunately, we have to finalize this session before the next one. I just want to make one personal comment.
Yeah.
Filtral enhancement, to enhance the filtral columns, in my opinion, this is the only way to create the illusion of shortening of the upper lip without any surgical intervention. When we have elder patients with very long upper lip, by creating, augmenting, or enhancing the filtral columns, this is the only way by which we can create an illusion of shortening of the upper lip. Do you have any other tips or tricks for upper lip shortening without surgery?
I totally agree to that. And of course, we could use a neuromodulator in combination with a filler to create a better eversion of the upper lip. It's a little bit more unpredictable, but I think we sometimes have really good results with that as well.